أنا من العراق من السماوة. كان ذني ما يسيطر عليهن ولا يقدر ينام، لا يقدر ياكل، لا يقدر يمشي، وسوينا له عملية بالعراق وفشلت. فاتصلنا بالأخ عبد الحميد هنا ودلانا بالدكتور هنا ودخلوا أجهزة بجسمه، ردوه مثل ما كان قبل، والحمد لله جاي يتحسن. بعد ما مكمل علاج حاليا، من يكمل يتحسن أكثر بعد. الدكتور هناك سوى له عملية قال نجاحها 99%، تالي 1% ما انطانا، وصارت حالته أسوأ من قبل بالعراق.
Mr. Husein is 45-year-old male patient who came all the way from Iraq for treatment in India. This gentleman was suffering from disease what we call Parkinson's disease. Commonly, this has been described as a tremors. In this, patient will not be able to lead a normal lifestyle because of excessive tightness in the body, tremors in the hands, and slowly patient goes in a steady state, mask-like phases. So he was on a medical management since last 2.5 years, but even then symptoms were progressing and medicines are not giving much help to him. So he sent his reports, he consulted at other hospitals in Delhi NCR also. So we suggested him to come to India for a complete evaluation, and if we found this case suitable for deep brain stimulation surgery, then we will proceed for it. So he came, we evaluated him, and he found to be fit for this surgery, DBS surgery. In layman language, what we call it, putting a chip in the brain to control the current of the brain. So brain is basically just like a computer. So there are so many circuits in it, if we talk in a layman language. So certain circuits, if they have low current, then there are a different set of symptoms. If there is a high current, then there are different set of symptoms like dystonia and these things. So for that, a good evaluation with a 3 Tesla MRI and clinical evaluation, blood test, that is required. So the ultimate diagnosis in his case was Parkinson's disease. So we prepared him surgery, explained all the procedures, procedure of surgery, hospital stay, and further stay in India. He got agree with this treatment, and we performed this surgery. The entire surgery was done in neuronavigation guidance. Me and Dr Sachin both, we performed this surgery, and that surgery lasted for about 4.5 to 5 hours. Immediately after surgery, the response was seen in the patient. His tremors were less, his mobility is better. He is still in our follow-up because we advised him to stay here in India for another 10 days so that we can adjust the current of that chip, the DBS device. And when he is having complete remission of symptoms, then we send him back to Iraq. So currently he is recovering. If you compare his pre-operative gait and hand movements, that is far better now. His tremors are controlled. He's being able to carry out his daily activities and able to eat on his own. Earlier, he came to us on wheelchair-bound status. So now he's walking, and his mobility has also increased. So he's very happy. He's saying, I want to go back early, but we are saying just for a few days he need to stay here for final adjustment, and I hope he will be all right. So what I want to convey that DBS surgery is a very good surgery in these movement disorder cases like Parkinsonism, dystonia, and other movement disorders. In this, it has a very good result, especially in the young patients. So that is the innovation of medical science, that these diseases, they are now can be made better with these devices. Thank you.